So the FLAURA2 trial is a phase 3 trial comparing single-agent osimertinib or osimertinib with platinum-based chemotherapy as first-line therapy for patients with advanced EGFR-mutant lung cancer. It was a one-to-one randomization to single-agent osimertinib or in combination with platinum-based chemotherapy, where patients would be treated with 4 cycles of combination platinum pemetrexed, followed by pemetrexed and osimertinib maintenance therapy. So we knew from prior studies or prior presentations that the combination improved both progression-free survival and overall survival compared to single-agent osimertinib. And in the presentation at ESMO 2025, I presented the outcome in patients with poor prognostic clinical or molecular features. And so the clinical features included brain metastases, liver metastases, bone metastases. In all 3 cases, whether or not patients had one of those poor prognostic features, the combination of osimertinib and chemotherapy led to improvement in overall survival compared to osimertinib alone. The differences were more pronounced in patients who had one of those poor clinical prognostic features compared to if they did not. And similarly, we looked at 3 different molecular features: the specific EGFR mutation, either exon 19 deletion or L858R, presence of concomitant TP53 mutations in the tumor, and then circulating tumor DNA at diagnosis where EGFR mutation was detectable. And similar to the clinical features, in all cases, whether or not patients had their cancer had one of those poor molecular features, the combination of osimertinib and platinum pemetrexed led to a better or longer overall survival compared to osimertinib alone. The differences were more pronounced in patients whose cancers had one of those molecular features compared to if they did not. And so overall, the presentation helped to reinforce that regardless of presence or absence of poor prognostic clinical or molecular features, osimertinib and platinum pemetrexed is a superior therapy compared to osimertinib and leads to an overall improvement in survival. So, of course, combination therapy had more adverse events, which mostly came from the addition of the 2 treatments together. So adding chemotherapy to a well-tolerated targeted therapy like osimertinib led to more chemotherapy-like side effects, so nausea, vomiting, and hematologic toxicities, as well as fatigue. There were no new side effects that emerged when the 2 therapies were combined together, and the combination did not lead to a greater incidence of interstitial pneumonitis than is seen typically with osimertinib, which is in and of itself quite low, but it didn't make that low number higher.